Hello, my name's Allie Snyder, and this is my policy brief presentation about family team decision-making meetings. Nationwide, more than 463,000 children live in foster care, and of that number, 10,068 of those children are in foster care in Washington State. Only 2,167 of the 10,068 children in foster care are available for adoption. This means that 7,901 children who are in foster care still have a possibility of going home with their legal guardian. Keeping families together is incredibly important and beneficial to the growth and well-being of a child. Having mandatory family team decision-making meetings set in place for the families who are in the 16-month phase between when a case opens and when it closes is critical in keeping these families on track and giving them every single opportunity to get their children back. Family team decision-making meetings gather family members, child welfare, and mental health professionals and others closely involved in children's lives to discuss family strengths, concerns, and resources to develop a family safety plan. It is a process for families to make better decisions about caring for their children and keeping their families together. During the meeting, families will assist the social workers in creating the best plan for their family members who is in care. 74% of the time, these meetings result in a family member offering to be the foster parent to the child throughout the 16-month process. The process of risk assessment encompasses examining the child and family situation in order to identify and analyze various risk factors, family strengths, family resources, and available agency services. This assessment information can then be used to determine whether a child is safe, what agency resources are necessary to keep a child safe, and under what circumstances a child should be removed from or returned to his or her family. The whole idea of the FTDM is centered around child safety and ensuring the necessary resources are available to the families. Before FTDMs, children in foster care only had one option available to them. A system of strangers created a plan for the child without the family's input. As the number of foster parents has decreased over the years, the state has implemented this program to help keep families together and give the children a safe place to go. I would now like to show you a video that gives you a brief explanation of what an FTDM is.
Move on with things. It was really a burning bush moment for me, honestly, where I realized that the only way that I could participate in helping my child stay alive, which was my fear, was to get sober and get help. I had support as this process went along in a way that I never really had before because they really listened to me.
It has been the most invigorating kind of social work practice in my whole career. A little girl is neglected, abused. Maybe she's your niece, your granddaughter. Child Protective Services are involved, and legal standards of care and protection must be met. You have two options. One, a system of strangers creates a plan and tells you what will happen to her. Two, child welfare professionals gather your family, everyone who has a heartfelt interest in this little girl's well-being. And, with support and structure, you decide on a plan to keep her healthy and safe. The first option is the system as it is.
Oregon had a lot of success with a similar program called Family Unity Meetings. The FUM model places an emphasis on maintaining the child's attachments to the parents and other relatives whenever possible. Family members actively collaborate and plan for the child during the Family Unity Meetings. The resulting involvement of families creates a collaborative rather than adversarial relationship with child welfare practitioners. Oregon has found that families who have made their own plans are usually willing to carry them out. It is beneficial to the children if they can be placed with family members or if their family members are involved in the foster care process because it lessens the feeling of abandonment. Children and families with an income of less than $15,000 are 16 times more likely to be physically abused, 40 times more likely to be physically abused, 29 times more likely to be emotionally neglected, 56 times more likely to be educationally neglected, and 22 more times likely to be seriously injured from abuse. The stresses and the pressure that comes along with being a parent of an extremely low-income family can be too much for an individual to handle sometimes. FTDMs offer a number of resources to parents and help get them on their feet. They offer counseling services, housing services, and food services to struggling families. Whatever these parents need to get their children back, the social workers will come up with a list of services during an FTDM. Adoption can also have a lot of stress on a child. It may result in lower self-esteem and lack of identity, or a child might have a loyalty conflict between her adoptive and biological parents. FTDMs focus on keeping families together, so the child doesn't have to go through this. The goals of FTDMs are to help child protective workers better identify situations where children are vulnerable to abuse or neglect of some kind. Another objective is improving the consistency of service delivery, helping administrators to decide the relative priorities of CPS case for service delivery. A good risk assessment system should help staff members design outcome-oriented case plans and target services effectively. How can you support the FTDM policy? Supporting local funding for programs such as First Step, First Years, Incredible Years, Drug Counseling in Collin County, Section 8, and a number of other local programs. A number of these organizations receive the majority of their clients through referrals that happen during FTDMs. To keep this excellent program going, we have to keep all these support programs running. Keeping families together when possible is the best thing we can do for children, so let's support the resources that can make this happen. Thank you.